I work at the Department of Health and Social Care, and I lead on our policy work within the Directorate for Science, Research and Evidence, which is the team that Chris Whitty and Louise Wood head up, so it's very much kind of the home of the NIHR within the department. I also work for the Office for Life Sciences, who are responsible for the Life Sciences Industrial Strategy and the 2 sector deals that have been published, and I co-lead their work stream on clinical research. So in some ways, in the Department of Health and Social Care, everybody looks at research in the team that I work in, and I focus on industry and how we make a great environment for clinical research. And within OLS, everybody looks at industry, and I look at clinical research. So bringing that together. So that's very much the context that I'm bringing to what I'm going to talk about here, and really echo everything that we've heard this morning and hopefully reinforce it. I just want to mention that although my role is very industry focused, that I spend a lot of time talking about the ecosystem, and that while we want to have a great environment to attract industry research in and to increase investment, and for that to be collaborative as well as just solely commercial research, we will not achieve that if we don't have a great, well-functioning ecosystem for clinical research. And that includes charity research, it includes academic research, and we're very much building on the strengths in that space. So as much as this has an industry frame on it, this is very much about the entire research enterprise. So obviously you will be familiar with the mission. I'm not telling you things that you don't know here, but just I think it's important that we locate this work in the context of what we are all collectively trying to achieve. The NIHR's mission is in the centre here. Hopefully you're familiar enough that the writing isn't too small, but you would know what it would say. And obviously we have a focus on improving the health and wealth of the nation through research. And one focus of that is about ensuring that we have a really highly skilled workforce available to deliver research, and that we lead in that space. We absolutely are the leaders in that space, and I think this initiative is a really great example of that, and the international leadership role that we've got there. We also then obviously need to have everything in place in order to deliver that mission, so it's also about making sure that we're supporting research and delivering as we need to. Some of you may be familiar with the Life Sciences Industrial Strategy, but just to kind of tell you a bit more about it, because I think often people aren't that familiar with the detail. The industrial strategy, there is a government-wide industrial strategy, which is quite thin, and then particular sectors have been asked to say, what does your sector need in order to deliver? And the Life Sciences Industrial Strategy is essentially the industry setting out, if you want to have a really thriving life sciences sector in the UK, what are the things that you need to get done? Continued investment in the NIHR, you'd be happy to know, is in there, along with a whole range of other measures. And the second life sciences sector deal, which came out just over a year ago, has a real focus on clinical research. And I was very involved in that work and led the clinical research work stream and engaged with a huge number of industrial partners and researchers across the system. And availability of workforce came out as an absolutely critical issue that we are nowhere near cracking. And we absolutely do need to be thinking strategically about how we ensure the workforce are available. And while NIHR, through the CRM, clearly funds a significant proportion of the clinical research workforce, everybody in this room knows that if it was only about that workforce, we wouldn't be delivering anywhere near the volume of activity that we do. So the availability of the workforce in general across the NHS is absolutely our scope here, and how this sits within that general research workforce across the NHS has to be part of how we think about strategically making sure that we have the workforce to deliver. And I'll come back to some of the things that we heard when we were doing that engagement later on in my talk. I also just want to highlight the NHS long-term plan, which has a section on research within it, which is fantastic. It completely endorses the industrial strategy and the sector deal and makes a commitment to deliver on the things that are in there. It also recognises, I think this is really important to have it in the long-term plan as a strategic document, it recognises the role of research in improving healthcare outcomes and really gives us a platform with which to have those wider conversations with the system. So the message I hope you will take from this is, from all sides, strategically looking at the workforce is absolutely what we need to be doing, and that is the kind of backdrop for our mission. But we operate in a very challenging context. Now I know you won't be able to read all the words for this, so I'll read some of it out, but it echoes what the last speaker was saying. And this focuses on nurses, and it's a BMJ article at the end of last year about the nursing workforce crisis. But actually this could have been about any number of healthcare professional roles. And it highlights that over the past decades, specific specialties have lost numbers, but at the same time that the general population has risen, and key aspects of NHS workload have grown substantially. So elective work is up 26%, the outpatient attendance is up 33%, and this ought to be, in some ways, an opportunity for us. If all of that activity is going on, we've got a bigger population, we've got more opportunity to do research, but we, as you all recognise, are operating in a very cash-restricted, workforce-restricted environment. And this is not going anywhere. And I think if there's one message that I would like you to take away and think about as you, in terms of whether this is the right thing to do, we are not going to fix this anytime soon. So in terms of thinking that actually, even I personally don't think that there is an ideal world where nurses or doctors would be doing everything. I think that the clinical research practitioner role is absolutely essential, as has been highlighted by the speakers we heard from this morning. But even if that was your view, it is just not going to happen. So if we want to realise the ambitions of increasing research activity, increasing those opportunities for patients, we simply have to think about doing it differently. And so actually we just have to get real about it. And I think that this initiative has been going on for some time, has made great progress, but we really need it to motor now if we're going to tackle this. So why are CRPs the answer? So as I've said, we've got this workforce crisis, and we need to think about skill mix and to think about how we add capability to teams in realistic ways. As we've heard, our CRP community, our CRP practitioners across the system are highly educated and highly skilled. And I'm frankly shocked to hear what you said on Harry. No, I think it's great. I think it absolutely needed speaking in the room, and I'm really shocked that that's the way that you get treated. And I think to hear some of those comments that it shouldn't be acceptable. And so thinking about how we add to skill mix and recognising the depth of expertise and the value that this workforce can add, I think is really important. They also bring an opportunity for additional skills. If we've got a limited healthcare practitioner workforce, it's really important that we use those people for the things that they are qualified to do, that they do the things that are outside of the scope of practice of a CRP, and that we use that workforce appropriately. So building on the skills that they bring, there's a lot of work in terms of how you actually manage a study. I'm thrilled to hear that you're PI for a study, because actually so much of that work is nothing to do with clinical practice. It's about project management and getting things set up in a timely manner, and relationship building and making things happen across the trust. That is fantastic use of resource, and really mean that if you need your medical and nursing and other healthcare practitioner workforce available to do other work, that their time is not being taken up with that work. And I just want to really underline, because it hasn't quite been said, that the regulators are happy with that. You wouldn't be working on CTIMs if the regulators weren't happy with that. Industry are happy with that. They just want to get the work done. So if you say to them, actually, this is the best available workforce we've got, and you get the work done, they'll be quite happy with that. So in terms of whether this is should people be doing this activity, I hope we are past that. I suspect not. But having the clear scope of practice, I think, is essential. And having a greater understanding of that scope of practice can only improve things. And I think it's important to recognise, as has been said, that this is complementary to that workforce. This is not about replacing our healthcare practitioner workforce within research. It's about being complementary to it and expanding it and looking at actually this can really help strategically change our ability to deliver. So in terms of then, if I'm making the case for why we need CRPs, why do we need the CRP registry? And I do think across lots of groups it is about credibility, confidence and trust. So first of all, for patients, I think it's really important that patients understand who's in front of them, and that we need patients to have confidence in the research system and the people that are involved in their care and their treatment. And being really clear about what the role is, having consistency of job titles so it becomes a recognised role, can only help establish that. So having patients at the heart of how we think about doing this, and also making sure that we can actually get the research to them, because we have an increased workforce to do that. Also then thinking about the wider team that people work with, and the trust that they work within, and the broader NHS. Having clarity about the scope of practice, having this recognised through a register and it being a really well-established role can only help other people have confidence in it. If we want to grow this, it needs to be something that's more recognised, that people feel, actually, I can be confident that employing somebody to do this activity is completely legitimate and I'm working in a well-established framework to do that. So I think it is about, the register will absolutely help do that. That's also true for industry and researchers, that when you are saying to them, actually this is the right person to work on this, that you don't have the rigmarole that has been described, and it is quite easy to say, actually this is a clinical research practitioner, this is the level of experience they've got, that's why they're completely the right person to do this activity, and it becomes a very straightforward conversation, which can only help speed things up and enable us to deliver more research more quickly. And finally, I think it's really essential for the CRPs themselves. I think it's time we treated this as a really legitimate role and use the register as a mechanism for supporting that legitimacy. If we are going to attract people into this role and keep them in it, it needs to feel like a legitimate role that's valued by the system, but that it also has a clear career path. And actually having a register and having all of the scope of practice and the infrastructure that goes around that can only help make this an attractive proposition. Whereas if it's something very vague that you can't even really describe to people, how are we going to attract people into it? So having that description, both in terms of the future CRP workforce, but also really valuing the workforce that we already have, I think is absolutely critical. So the messages I want to leave you with is really a call for support, both for the CRP role in itself, because I really don't think we're going to achieve our aims without thinking strategically and creatively about the workforce that we need. And we have a really viable option here to add a lot of value into the system, to offer really great employment opportunities and really exciting careers, and we should be building on that to achieve our aims. So both for the role itself and also for the register. And as has been mentioned, this has a lot of national support. I mean, the network have been investing in this for some time. Myself and other colleagues from the department are here today, and we're very supportive of this initiative. So in terms of, like, does this have support within the system? It does, but it simply won't happen if it isn't driven locally. In terms of, actually getting the roles in there, getting people on the register, having them supported as they develop their careers. So it really does need to be taken up and owned by people in individual trusts and other settings to make this happen. So I really hope that one of the things that you come away from today is feeling very convinced about that and being supportive of this and thinking about what you personally can do to take this forward. Thank you.